Magandang araw po muli. Pagpapatuloy natin ang ating pag-aaral tungkol sa dugo o SWE. Number 6 na po tayo. So, causes of blood deficiency. Ano po yung dahilan bakit nagkukulang tayo ng dugo? So, una dito yung diet and eating habits. To produce blood, you need to eat blood-building foods. Many vegan, vegetarian, or low-fat diet lack blood-building foods and are supplemented poorly. So, overconsumption of wheat inhibits spleen function. So, yung pag madalas tayong kumakain na ng mga karne, yun naapektuhan po yung ating spleen. Restrictive diets and fasting deplete us of food. Kaya yung mga nagpa-fasting po, syempre kung wala kang kinakain, walang magiging dugo. So, magkakaroon ng kakulangan sa dugo. So, causes of blood deficiency, damp or cold foods. Ano ba yung mga damp or cold foods? Ayan po yung ice cream. Nakikita nyo, no? Yung mahihilig sa mga ice cream, ice candy, kung ano-anong mga pagkain na malalamig, matataba. Inhibit spleen, transforming function. So, yun. Pag kumakain po tayo niyan, yung function nitong spleen, hindi niya magagawang maigi. Kasi puro lamig, hindi siya makagalaw. So, when we consume too many damp or cold foods, yung damp po yung maraming mamantika, matataba, it's like throwing wet leaves on the digestive fire. So, yun. It slows down and clogs up spleen, yung pali. As a result, spleen produces less blood. So, ganun po yung ginagawa natin sa ating spleen pag kumakain tayo ng malalamig na pagkain. Tsaka maraming mantika. So, how we eat affects quality of our blood. Eating too much at once. Alam ba yun? Nandun ka sa eat all you can. Eating too quickly sa umaga, nagmamadali ka sa umagahan, hindi mo nang inuya. Irregular eating habits on the run. Yan. Kung kailan ka makaisip kumain, saka kakakain. Eating while working. Yan. Habang nagtatrabaho, nagkumakain. Siyempre, nagagamit mo yung energy ng spleen sa pag-iisip, kaya hindi rin magpapunction ng maayos yung spleen mo. Or eating before the bed impair. Spleen ability to transform and make blood. Halimbawa yung gabi na sa kakakain na, no? Ngayon, matutulog ka na, hindi na masyadong mag-perform yung spleen mo dahil tulog ka na yung energy mo na bumabagal na rin. So, hindi ka matutunawan. Kaya, pag di ka natunawan, walang mapuproduce na maayos na blood. Kaya binabawal din po yung kumain, di ba, na matutulog ka na. So, ito rin po yung isang dahilan. Pag marami kang worry, anxiety, overthinking. Kasi ito yung emotion ng emotion na nakaka-affecto sa spleen at saka stomach. Spleen was affected by worry, overthinking, anxiety. Kaya kung masusubukan po ninyo, pag kayo ay sobrang nag-iisip, nag-worry, biglang humahapdi ang tiyan, bigla kayong ginugutom kasi nagagamit po yung energy ng spleen stomach. Constant multitasking. Ayun, ang dami-daming ginagawa. Habang sa mga nanay, multitasking Yung mga nag-opisina, ganun din minsan. Mga teacher, ganun din. Detailed mental work. Kung laging ginagamit mo yung utak, halos hindi na nagpapahinga. Yun. Office or school work. Ang daming requirements na pinapagawa ni ma'am. Ang daming assignment. Kaya yun, titingnan nyo yung mga dila ng anak natin. May mga crack na dun sa spleen stomach. Lingering worries. Lagi ka nag-aalala sa buhay ngayon. Tingnan po ninyo yung inyong line sa gitna ng dila. Nagka-crack na yan. Anxiety or psychological traumas all impact spleen ability to transform food into blood. So napakarami pong dahilan na para hindi maging dugo yung ating kinakain. Pag nagkaroon ng problema sa function ng spleen natin. These states can lead to a poor appetite, further complicating the cycles. Yun, mawawala ng gana or sobrang gana. So pag nagkaroon po ng suliranin ng ating spleen, aapektuhan niya yung ibang organs natin. Excessive work, sa rin po yan Physical and mental work, consume chi and blood. Siyempre, pag gumagana yung isip natin sa katawan, yung dugo natin yung ginagamit natin. So when we rest, liver restore blood and sends it out when we need it. So kailangan ng pahinga para nakakapag-store yung blood. So when blood is deficient and we're pushing out ourselves, we are using up the reserve. Halimbawa, kulang na nga yung blood mo, nagpipilit ka pang, nagpupuyat ka pa. So ang ginagamit na po nung katawan natin yung reserve energy. Yan. Muscles and tendon do not get nourished. So makakaramdam na po tayo ng numbness, frequent sprain, mga body ache, fatigue, more vulnerable to injury. So yun po yung ating mangyayari sa katawan natin. So isa pa rin pong dahilan ng blood deficiency ay kung may blood loss o may trauma. Halimbawa yung sobrang menstruation, yung nanganganak, sobrang maraming inaanak o yung dinudugo habang nanganganak, nagkakaroon ng internal bleeding, blood loss through physical trauma. May mga na-aksidente din po. Yan, pagiging dahilan ng kakulangan ng dugo. So, holding in emotion. Liver is responsible for supplying chi to spleen. So, yung po ang role ni liver. Liver is susceptible to anger and tends to stagnate when our expression is black. When liver is stuck and cannot support spleen, blood deficiency result. Yun po. Kaya kung lagi tayong mayroong mga emosyon na galit, naaapektuhan po nito ang paggawa ng dugo ni spleen. Kasi wala siyang ibibigay na chi kay spleen para gumawa ng dugo. So, yung excessive thinking, drinking, or drug use, ganun po yung mga sobrang nagiinom, excessive drinking or drug use weakens ability of liver to store blood and creates damp in the spleen. Okay po. So, yun po yung mga dahilan ng pagkukulang ng ating dugo.
Thank you very much, Ma'am Mildred. We will now proceed to tongue diagnosis. Let's call on Ma'am Teresita Sumile for comparison of pulse and tongue diagnosis. Good afternoon, Ma'am Teresita.
Good afternoon po, Dr. Hector and classmates. Welcome po sa tongue diagnosis and now we talk about comparison of pulse and tongue diagnosis. We all know that qi moves the blood. The quality and dynamics of the movement of qi reveals itself in the pulse. The pulse mainly describes the present energetic condition of an individual. Okay? Now, by feeling the pulse, the practitioner enters into a close relationship with the patient, perceiving quality of patient's pulsating energy. Okay? Now we have here a case of a 60-year-old woman who always put the needs of others before her own. Wow, she is very selfless. Complained about intense inner tension. Her tongue was normal. The pulse was very wiry and thin. From the pulse and symptoms, it is clear that she had developed liver qi constraint. In the course of treatment, the woman was eventually able to begin fulfilling her own wishes rather than those of others. Slowly, the pulse became less wiry, and this was accompanied by a greater sense of joy in her life. In this case, it was the pulse much more than the tongue that reflected the true energetic state of the patient. The pulse, however, did not provide any indication of the length or depth of the liver qi stagnation. For its part, the normalcy of her tongue did not reflect any disharmony, or might have suggested that it was not that deep or serious. So this example illustrates that pulse diagnosis can be quite accurate when the tongue signs are inconspicuous. In this case, the pulse was given priority over the tongue. So if the tongue signs are not clear, so the tongue pulse will be given priority over the tongue. Okay? The tongue reflects condition of blood body fluids essence more clearly than does the pulse. There are pulse qualities like the choppy pulse, which indicate blood deficiency. However, depth and severity of such deficiency is difficult to judge from pulse alone and can only be made by an experienced practitioner. Okay? Yet a thin, dry, or contracted tongue makes the condition easy to detect, especially if the color, shape, and texture of the tongue obviously deviate from normal. In such cases, the tongue is given priority over the pulse. Okay? Pulse and tongue signs deviate from each other. If the tongue body is pale and swollen, practitioner may expect a slow or submerged pulse. But if pulse were fast and floating, this could be the result of the nerves of a person who is arriving late for appointment or fear of consultation, or it might be from the result of shock, coffee, or medication. Okay? The pulse can change very quickly and responds to the most present event in a patient's life, while the tongue will remain unchanged. To summarize, the qualities of the pulse accurately reflect the present energetic condition of an individual. The qualities of the tongue, body, color, shape allow one to predict long-term changes in the energetic state. The tongue coating is a very important indicator in case of acute illness. So this is the comparison of pulse and tongue diagnosis. Now let's go to our patient, female, 37 years old. As we can see in the tongue picture, it is pale, swollen, and has teeth marks. The tip of the tongue is red and slightly contracted, and the coating is slightly yellow, thin, and slippery. Patients presented symptoms of depression, no drive, no appetite, abdominal pain at time of ovulation, intense feeling of cold during menstruation. Western diagnosis is ovarian cyst. Background to disease: excessive worry due to unemployment, overconsumption of sweet foods, emotional problems. TCM diagnosis: spleen yang deficiency with accumulation of dampness. So it is reflected in a pale tongue body color with swollen body shape and has teeth marks. The patient presented symptoms of no appetite, abdominal pain at time of ovulation, and intense feeling of cold during menstruation due to overconsumption of sweet foods. Next is heart blood deficiency with heat from deficiency in the heart. Again, it is manifested in a red and slightly contracted tip with symptom of depression and has no drive, resulting from a background of excessive worry due to unemployment and emotional problems, because heart is affected with all emotional problems. Okay? And the last diagnosis is food stagnation with accumulation of turbid dampness. Is reflected in a light yellow, thin, and slippery coating. Yun lang po. Thank you so much for listening.
Thank you very much, Ma'am Teresita. We will now proceed to diagnosis by interrogation featuring mental emotional symptoms. We are now going to discuss patterns in depression. Chinese books normally ascribe mental depression to liver qi stagnation, including liver qi stagnation turning into heat and liver qi stagnation with phlegm. In the later stages of mental depression, empty patterns appear. Thus, although in Chinese medicine, stagnation and depression are almost synonymous, empty patterns can also cause depression. In severe depression, the liver is always involved due to its housing the ethereal soul. The ethereal soul is responsible for our life's dreams, plans, ideas, projects, relationship with other people. The ethereal soul was often described as the coming and going of the mind, or the Shen. This means that the ethereal soul assists the mind in giving it the capacity to have dreams, plans, ideas, and projects. In this sense, the ethereal soul gives the mind movement, projection towards the outside, and ability to form relationships with other people. The mind guides and controls the ethereal soul, and most of all, integrates the activity of the ethereal soul within the overall psychic life of the person. Thus, if the movement of the ethereal soul is lacking, either through lack of activity or the over-control of the mind, the person is depressed. If the movement of the ethereal soul is excessive, which can be due to overactivity or lack of control by the mind, the person may display manic behavior. Bearing in mind that this manic behavior may vary in intensity and seriousness from full-blown bipolar disease to much less severe manifestations that are common in mentally healthy individuals. When a person is severely depressed, the ethereal soul is not coming and going enough, and therefore the person lacks dreams, has lost faith in the future, does not know which direction to take in life, and has a feeling of loss, isolation, and separation. So many liver patterns, and not just liver chi stagnation, may cause patterns, may cause depression. When the ethereal soul comes and goes too much, the person may develop manic behavior. So the person has lots of dreams, projects, and ideas, pero walang nangyayari, no? Nothing comes to fruition because of the chaotic state of the ethereal soul and lack of control of this by the mind. Okay? Essential to the proper movement of the ethereal soul is its restraint by the mind. The mind, which is the Shen of the heart, needs to restrain the ethereal soul, but not too much, and integrate the material coming from it into the totality of the psyche. If the mind controls and restrains the ethereal soul too much, kakaroon po ng depression. If the mind fails to control and restrain the ethereal soul, magkakaroon ng manic behavior. Okay? So, check and balance talaga. So here you could see that the mind and the ethereal soul, they have this check and balance. No? The mind controls and integrates, while the ethereal soul will give movement, ideas, inspiration, intuition, creativity. Yung mga plans niya will come into fruition. And then here we have, if we have the mind over controlling the ethereal soul, as you can see the boldness of the arrow, okay, there will be depression. So if the mind is unable to control and integrate, there will be mania. Okay. So if we have fire, phlegm fire, and liver blood and or liver yin deficiency, this will result in the hun coming and going too much. So pwedeng magkaroon ng mania. And if you have liver chi stagnation, liver blood and liver chi deficiency, spleen and kidney deficiency, who not coming and going enough. So pwede magkaroon ng depression. Okay? Thank you very much. Next, we go to pulse diagnosis. Let's welcome again Ma'am Mildred na hindi talaga napapagod. Good afternoon ulit, Ma'am Mildred.
Gandang hapon po muli. So, magpapatuloy po tayo sa ating pag-aaral ng pagpupulso, pulse diagnosis, the normal or healthy pulse. So, the normal or healthy pulse po, healthy pulse is called Fing Mei. in Chinese. For a pulse to be healthy, it must have certain qualities. It must have shen, stomach, and root. A pulse that lacks these qualities is called a sick pulse or Bing Mei. Having shen means that the pulse has vitality, is soft and yet has strength, and is regular in its beating. The pulse gets the shen quality from the heart. This is similar to the quality that should be seen in tongue and eyes. So if a pulse has shen, the heart is harmonious and the prognosis is good. So nakikita natin yung kinang ng mata, sabi nga nila, kinang ng mata. Kung may sakit, di ba, na nakikita natin sa mata, yung parang makulimlim, malamlam. Having stomach means that the pulse is relatively slow, 60 to 60 beats per minute. So yun po yung normal is calm and soft. The stomach quality comes from the stomach and spleen, transformation of body fluids during digestion. This is similar to the tongue, where the coating on the tongue is generated by the transformation processes in the middle jaw, just as the tongue should have a thin coating indicating health. The pulse should have a smoothness and softness. Too much of these qualities on the tongue and pulse indicate dampness, reflecting that there is too much impure qi being sent upward with a pure qi. So, yun po yung normal healthy pulse. 60 to 60 beats per minute. Having a root means that the pulse can be felt at the deepest level and in the qi position. So, it is the kidneys that gives the pulse root. If the pulse has root, it indicates that the kidney are strong and can anchor qi. Kasi di ba yung qi nga, andun nakalagay yung ating mga manang enerhiya. These three qualities represent the three treasure, Sen, Qi, and Jing. So, spirit, energy, at dugo yung Jing. Jing ay yung essence. All three qualities must be present in adequate amounts of the body. Amounts for the body to be harmonious, even though the pulse can have many different qualities. And even if the person is ill, a ping mei or healthy pulse will indicate a good prognosis. So, yung disturbing factors and natural differences. There are several factors that must be taken into account when diagnosing the pulse. This is because these factors can alter the quality of the pulse. So, yung ibang mga factors po ay natural difference caused by, for example, the changes in the season or the person's gender or age. Diba, siyempre yung mga may edad na, minsan talaga yung pulse nila mas mabagal. Other thing can be artificial factor, such as medicine or coffee. Halimbawa, yung may mga iniinom ng gamot, nagbabago po yung pulse nila. Yung mahihilig sa kape, pinababago din ito ang pulse ng katawan. The best time of the day to take the pulse is early in the morning. So, mas umaga. Just after the person has woken up and before they have become physically and mentally active. At this time, the pulse will give the truest impression of the person. This is obviously unrealistic in a normal clinic and only something you would be able to do if you work within patient. Kung yung home service natin na mas maaga, mas makukuha natin yung tamang pulse nila. Kasi pag pumunta na sa clinic, napagod na, nagbiyahe na, so minsan po, kailangan talagang nag-rest muna. If a person has just walked briskly, cycled or run up the stairs, or is stressed, heat will have been generated in the body and the pulse rate will be faster and stronger than normal. So the pulse is not giving a false impression of the body's physiology. On the contrary, it is a giving very accurate impression of the body's condition right now. So the pulse showing that there is a state of excess heat caused by the physical activity. Their face will probably also be slightly redder and their skin warmer than normal. So kung may init po, ganun makikita natin, medyo namumula yung mukha. Saka mainit yung balat. It's therefore important that the client is calm and relaxed when taking the pulse. So it is usually delay taking the pulse until the end of interviewing of the client. So kailangang napahinga muna po yung pasyente bago natin ipupulso. This is because I want the patient to be as relaxed as possible after their arrival at the clinic, and because new patient may be nervous if it is the first time that they have been treated with acupuncture or Chinese herb, and this could affect the pulse. Lalo pa pag nakita nila yung needle, yung pala takot sa needle, bigla nang pabilis yung pulso. So kailangan po ikakalmo na yung pasyente. By waiting, one can hope that they will relax as they gain confidence in the therapist and become comfortable with the situation. Minsan po ang ginagawa natin pag ganun, mag-inhale, exhale muna, pahigain nyo, or minsan papainumin muna ng tubig, nakaupo, inhale, exhale siya, hintayin na ma-relax. Ganun po. Okay po?
Thank you very much, Ma'am Mildred. Next, we go to differential diagnosis. Let's welcome Ma'am Neets Yu. Good afternoon, Ma'am Neets.
Good afternoon, Doc Hector and everyone. Okay. Welcome to our TCM Foundations number 188, Tang Chi Deficiency. Parang ako yan. Okay. Etiology, yung causes po, hereditary weakness, poor posture which constricts the breath, exposure to cold, prolonged grief and sadness weakening the lung chi, repeated impairment of lung chi diffusing and descending over long time. Okay? Signs and symptoms, shortness of breath, panting, worse on exertion, forceless cough with profuse watery sputum, weak voice, spontaneous daytime sweating, dire-diretso yung sweating sa day. Dislike of speaking, halos ayaw magsalita. Pale or bright white complexion, easily catches colds, tiredness, dislike of cold, feeling of cold, cold hands, cold feeling of upper back, absence of tears. Tears, hindi siya nauuhaw, okay? Yung pulse kapag pinalpate mo ay weak, especially sa right front position, okay? Yung tongue, makita mo ay pale, slightly wet, and white fur or white coating. Okay? Treatment principle, strengthen lung chi, supports defensive exterior. Acupuncture treatment points, lung 9, supplements lung yang. Brain 6 or CV6, supplements original chi, fortifies yang. DU12, GV12, GV12, governing vessel 12, relieves cough and dyspnea. CV12 or N12 supplements earth to strengthen metal. Bladder 20 supplements the spleen. Okay. Lung 7 promotes descending of lung chi. Bladder 13 supplements lung chi. Stomach 36 supplements stomach and lung chi. Bladder 43 supplements lungs, and spleen 3 source point of the spleen. Okay. Ang needle technique ay with supplementation, and you can use moxa if it is required. Thank you. I hope you learn from here. Thank you po.
Yeah, medyo meron talaga kayong lung chi deficiency.
Yes, Doc. Nakuha ko doon sa
Anyway.
tapos na ano. Okay. Thank you po.
Thank you very much, Ma'am Neets. Next, we go to acupuncture patterns and practice. And Ma'am Teresita Sumile will continue her discussion of dysentery. Good afternoon, Ma'am Teresita.
Good afternoon po, Dr. Hector and classmates. Welcome po sa Acupuncture Patterns and Practice. And now let's continue our lesson yesterday on dysentery. Key points of analysis. Characteristics of feces. The color of the feces often varies with the changing features of the illness. In general, if the feces are white in color and are like either granulated jelly or nasal discharge, the illness is due to cold or abnormality of qi. This usually indicates a mild illness, though the pattern may also be seen in chronic dysentery. Sleek white feces suggest an illness of this deficiency cold. White pus suggests an illness of heat. In general, red feces or feces with bright red blood indicates an illness of heat. Fire or blood, this usually indicates a more severe illness. If red and white are interspersed in the feces, the illness is mainly due to heat, with both qi and blood affected. The illness may be mild or severe if sorry po, if interspersed red and white make the feces resemble fish brain, the illness is due to heat. But if there is more white than red, it may be due to cold. Purple feces indicate blood stasis, and dark purple and thin feces indicate yang deficiency. If the feces are a burnt black in color and are thick and strong in stench of illness is of fire. If they are deep yellow and foul smelling, the illness is of heat. If there is undigested food in the feces, the illness is of food retention. Feces that are light and only mildly malodorous, the illness is of cold. Feces that are multicolored indicate strong dampness. Feces that contain much pus and blood and are difficult to pass may be due to heat, dryness, or yin deficiency. Okay, now let's go to tenesmus. Tenesmus, due to exogenous pathogenic evil, typically lessens following defecation. If due to cold, the abdominal pain is spastic. If due to fire or heat, it is accompanied by urgency and burning of anus. If due to food retention, it tends to be distending with a hard mass and there is guarding. Tenesmus due to deficiency illness does not lessen following defecation. If due to deficiency cold or symptoms are more variable. Abdominal pain may be mild or vague without tension or firmness. There may be preference for massaging pressure or warmth, or pain is not bothersome. If due to qi deficiency or depletion, tenesmus is accompanied by fecal incontinence. If due to qi collapse, tenesmus is aggravated following defecation. If due to qi and blood deficiency, defecation is difficult, requiring much straining, yet sometimes unproductive. Now let's go to urgency and severity. The assessment of urgency or lack of urgency depends upon the clinical picture. Observe whether evil question is strong, whether stomach qi is suppressed, whether yin fluids are exhausted, and whether yang qi has collapsed. In severe illness, there are pus and blood without much fecal material in the feces. In milder illness, there is fecal material. Okay? If the frequency of defecation decreases, but the abdomen is distended and tense like a drum with vomiting, anorexia, restlessness, thirst, curse, tachypnea, the illness is due to blazing of disease, evil person burning, and attacking upward. In serious cases, there may be mental confusion, delirium, and a replete and rust pulse. If refusal to eat, prompt vomiting upon any eating or drinking, listless lethargy and eructation accompany dysentery, stomach G is on the verge of collapse. If the feces contain viscid pus and blood, and the dysentery is accompanied by restlessness, thirst, a flushed complexion with crimson lips, and a rapid, swift, and large pulse, yin fluids are on the verge of total depletion, or yin and yang no longer interact. If yang qi is on the verge of total collapse, the symptoms may be variable and include the following. The dysentery may be persistent and uncontrollable. Abdominal pain may be absent, but there is frequent expulsion of pus containing blood. Defecation may be absent, but there is lethargy with assumption of the fetal position and cold intolerance. The body may be cold with spontaneous sweating. The breath is short and the breathing very shallow. The pulse is either deep, thread-like, and slow, or indistinct and threatening to collapse. The appearance of certain symptoms also indicates potentially serious worsening, such as the following. Reduction in the frequency, but all of other symptoms show no improvement. Uncontrollable dysentery, increasing abdominal distension, agitation, increasing lethargy, worsening coldness in the hands and feet, and dissonance between the pulse and the clinical appearance. Okay? Now let's go to acupuncture treatment. Select LI4, stomach 25, and stomach 37 as the principal acupoints. Shang Ju Shu may be replaced by stomach 36, and then use piliform needles and apply the reducing method. If there is cold, add moxibustion. For dysentery due to dampness heat, add Li11 and stomach 44. If dysentery due to cold dampness, add CV12 and CV6. If dysentery will with inability to eat, add CV12 and stomach 44. For recurrent dysentery, add bladder 20, bladder 21, CB4, and bladder 23. If there is rectal prolapse, add GV1 and apply moxibustion to GV20. If tenesmus is severe, add bladder 21. Okay? Now let's go to case study. The patient was a 36-year-old male with history of dysentery. For 2 days, he had chills and fever, distending headache, body aches, and abdominal pain. Thereafter, he had red and white dysentery, tenesmus, and rectal prolapse. The feces were more red than white, with color resembling that of hog liver. He defecated over 20 times in 1 day. Wow, grabe. The feces soon changed to more white than red. He also had chest tightness, dryness of the mouth without thirst, a pale tongue with thin white coating, and a small, slippery, and rapid pulse. His body temperature was 38.8 degrees Celsius or 101.8 degrees Fahrenheit. Next, we'll go to therapeutic principle. Release the exterior, unblock the intestines, and eliminate retention. Yun lang po. Thank you so much for listening.
Thank you very much, Ma'am Teresita. We proceed now to signs and symptoms. Let's discuss trembling lips and peeled lips. Trembling lips, the first consideration would be spleen-chi deficiency. Slowly trembling lips, pale complexion, poor appetite, tiredness, slight abdominal distension, loose stools, pale tongue, and empty pulse. Another consideration for trembling lips would be a woman with blood deficiency with empty wind. Trembling and dry lips, itching around the mouth, dry skin, slight tremor of the head and or hand, facial tic, dizziness, blurred vision, unilateral numbness and or tingling of a limb, pale and thin tongue, choppy or fine, and slightly wiry pulse. Okay, you might also want to consider stomach fire for trembling lips. This time, rapidly trembling siya, no? Red lips, bleeding gums, intense thirst with a desire to drink cold liquids, foul breath, dry mouth, mouth ulcers, burning epigastric pain, mental restlessness, dry stools, sour regurgitation, nausea, vomiting soon after eating, feeling of heat, tongue is red with a thick, dry, dark yellow coating, pulse is deep, full, rapid. Okay, let's go now to peeled lips. First is spleen heat. Peeled, fresh red, cracked, and swollen lips. Dry lips, mouth ulcers, thirst, burning epigastric and or abdominal pain, excessive hunger, red tip of the nose, dry stools, feeling of heat, scanty dark urine, yellow complexion. The tongue is red with dry yellow coating, pulse is overflowing, rapid. Okay, we may also consider for peeled lips in a woman with splenium deficiency with empty heat. Peeled, dry, cracked lips, poor appetite, poor digestion, retching, knowing hunger, loss of taste, slight epigastric pain, dry stools, thin body, sallow complexion with red tip of the nose, night sweating, feeling of heat in the evening, malar flush, red tongue without coating, and transversal cracks on the sides, floating empty and rapid pulse. Thank you very much. If there are no questions, tuloy-tuloy po tayo sa next topic, which is atrophy syndrome. And let's call on hanapin ko pa. Ma'am Mildred, good afternoon ulit.
Yes po.
Oo, hindi pa pagod. Okay. So she will continue discussing the atrophy syndrome, still on patterns.
Okay po. Magandang araw muli. Ang ating pong topic ay pagpapatuloy sa atrophy syndrome, identification of patterns and treatment. So, tingnan po natin yung heat in the lungs. Injuring yin fluids. Yung clinical manifestation po nito, mayroon pong fever, weakness, and flaccidity of limbs that follow after the fever subsides, dry skin, mental restlessness, thirst, cough, dry throat, scanty, dark urine, dry stool. So dahil nga po heat, kung titingnan po natin yung tongue, ay mapula at walang coating. Ang pulse po ay fine and rapid. These are the manifestation of lung heat during yin, following an invasion of wind heat during a warm disease. Poliomyelitis would be an typical example, but muscular weakness and impairment of walking and children may also occur after other infectious febrile diseases. So yung treatment principle po dyan, kailangan pong i-clear ang heat. At saka cool ang blood and nourishing of lungs and stomach. So yung mga points po natin na gagamitin ay this is an acute condition and treatment should therefore be given every day. So do 14 po at bladder 13, lung 1, lung 5, stomach 44, stomach 36, spleen 6. So reducing method po on all points except the last 3 which should be reinforced. So ito pong stomach 36, spleen 6, and kidney 3, kailangan pong tonifying. Pero yung mga nauna po ay reducing dahil full heat in the lungs. Okay. So yung do 14 po ginagamit para mag-clears ng heat. Bladder 13 and lung 1 and lung 5 clears lung heat. So nagtatanggal po siya ng init. Stomach 44 clears stomach heat. Stomach 36 and spleen 6 and kidney 3 nourish yin and promotes fluids. Pag may invasion naman po ng mga damp heat, ito yung gawa ng mga init. So clinical manifestation po, makikita natin yung constant low-grade fever that does not abate with sweating. So kahit pinapawisan, andun pa rin, may lagnat pa rin. Weakness, heaviness, and swelling of the legs. Meron din pong numbness, a feeling of fullness of the epigastrium. Kasi may damp, kaya po ganun may mga feeling of damp, parang mabigat. Cloudy urine, a feeling of heaviness of the body. Yung parang ayaw niyang babangon. Bigat-bigat ng pakiramdam. Kung titingnan po natin yung complexion niya, yellowish, nag-yellow. Tapos pakiramdam niya ay mainit ang kanyang mga paa. Yung dila po, sticky yellow coating. Pag hinawakan natin ang pulso, slippery and rapid. So, ang treatment principle po natin dyan, clear heats, resolve dampness. Yung pattern naman po ng invasion of damp heat. Kung acute stage, treatment should be given every day. So, araw-araw po kung acute pa lang And this condition appears in middle of late stage of atrophy syndrome. It will usually be associated with an underlying deficiency of stomach and spleen, which should therefore be treated. So, do 14 po, gamitin natin. Large intestine 11, spleen 9, spleen 6, ren 9, bladder 22, and stomach 36. So, reducing method. Wala pong moksa kasi init po ito. So, bakit po natin ginamit ang do 14 and large intestine 11? Kasi siya po yung nagre-resolve sa damp heat na pumapasok sa katawan. Palalabasin niya. Spleen 9 and spleen 6 and ren 9 and bladder 22, siya din po yung nagre-resolve sa dampness. Mostly from the lower burner. So, mula sa lower burner. Stomach 36. So, i-reinforce to strengthen the spleen and stomach to resolve dampness. Palalakasin natin yung spleen and stomach. Pag may invasion naman po ng mga cold dampness, pag malamig ang panahon, madalas to. So, ang clinical manifestation po nito, nakakaramdam ng hilo, mabigat po yung pakiramdam, tapos parang puno yung epigastrium. Nagkakaroon din po ng pain in the back at saka sa shoulder. Yan, nagkakaroon ng pamamanhid yung likod, weakness, flaccidity, and coldness of limbs. So, pag tinignan po natin ang dila, pale, sticky, white coating. Kaya masasabi natin may cold kasi white coating. Yung pulso po ay slippery and deep. So, ang treatment principle po nito, resolve dampness and warm the spleen. Dagdagan natin yung init. Pataasin yung yang. So, yung point po natin ay spleen 9, spleen 6, ren 9. Bladder 22, stomach 8, ren 12, bladder 20, stomach 36, do 4. So, use reducing technique on the first 4 points. At the spleen 9, 6, 9, and bladder 22, reinforcing po Then, even on the stomach 8 and reinforcing in ren 12, bladder 20, stomach 36, and do 4. So, moksa po ay pwede dahil nga po ito ay lamig. Dagdagan natin ng init para mawala ang lamig. Spleen 9, spleen 6, ren 9, bladder 22, nagtatanggal po siya ng dampness. So, yung stomach 8 naman po, nag-i-eliminate din po siya ng mga damp sa ulo from the head. So, ren 12, bladder 20, stomach 36, pinapalakas po niya ang spleen chi. Do 4, tonifies the fire. of the gate of life. So far. So yun po yung ating mga points na pwedeng gamitin. Thank you po.
Thank you very much, Ma'am Mildred. We would like to thank everyone for joining, and especially our presenters. Hope to see you tomorrow for our next webinar. Thank you very much po.